Hi guys, my name is Kwan, and for today educational infomercial, we'll be diving into a disease called tuberculosis. Before we diving deep into the details about tuberculosis, such as the symptoms, preventions, cause, and the risk factor, I want to briefly mention the statistic about this particular disease. So according to the CDC, um, of the cases and rates of tuberculosis in the United States between 1993 and 2018, according to the tables, the number of cases has been significantly reduced in terms of case per 1,000 populations and just the number of cases overall. But there are still a significant amount of cases that is prevalent in the United States. In fact, in the 2018, also from the CDC, the Center of Disease Control and Prevention, stated that almost half of the tuberculosis cases in the United States come from the four major states: California, 23.2%, Texas, 12.5%, New York, 8.3%, and Florida, 6.5%. Tuberculosis is one of the oldest diseases known to affect humans. It is the major cause of death worldwide. Tuberculosis, or in short, TB, is a contagious disease that affects the lungs. The infectious bacteria disease that is visible through X-ray or CT, indicated by their nodules or tubercles that is formed inside the tissues of the lungs. There are two types of tuberculosis that we can see: latent tuberculosis and active tuberculosis. In latent tuberculosis, the bacteria reside inside of the host without replicating or causing any symptoms that we'll talk about later. For active tuberculosis, such as cavitary tuberculosis or miliary tuberculosis, as shown on the pictures, that is when the immune system cannot fight back the latent tuberculosis and the bacteria start to become more active and causing a lot more symptoms. Besides, there is a high probability of the bacteria spreading to others via droplets or airborne. The bacteria that causes tuberculosis, or people usually call it TB bacteria, is actually Mycobacterium tuberculosis, hence the disease name. This bacteria has a lot of characteristics that gives it its ability to avoid our immune system and to resist a lot of the antibacterial agents. Um, Mycobacterium tuberculosis is a gram-positive bacteria, which means that it shows a positive test in a gram positive results in a gram stain test. It is also rod-shaped and it's obligated aerobe, which means that it needs oxygen to survive. Hence why it's usually reside inside of our lungs, because that's where oxygen is coming in and out. The last characteristic, and it's also really important, of this bacteria is that it has a lipid-rich cell wall that contains mycolic acid. This mycolic acid cell wall helps us to resist a lot of detergents and also antibacterial agents, as well as antigens from our own immune system. There are two categories for people who are at high risk of developing tuberculosis. One is people who recently infected with TB bacteria, and the second is people with weak immune system. People who are at risk for TB bacteria are people that comes in close contact with TB diseases, or people that immigrated from area with high rates of TB. Nurses, doctors that work in a facility such as hospital, homeless shelter, nursing home, also are in high risk of developing TB diseases because they're in contact with a lot of patients with TB, either latent or active. People with weak immune systems, such as children less than 5 years old, immune suppressed patients that are usually after a organ transplant, are also very susceptible to TB. HIV infections, the virus that cause AIDS, also cause the patients to be more susceptible to TB. In addition, patients with underlying issues such as diabetes and low body weights also are in the risk of getting the disease. Latent tuberculosis infections patients do not usually show any symptoms of tuberculosis or even spreading Mycobacterium tuberculosis to others. But for active tuberculosis patients, there are some strict symptoms that they can see. First of all is that if there is a long-term cough that lasts more than 3 weeks, severe chest pain, especially coughing up blood, and other common symptoms such as chills, weight loss, no appetite, fatigue, cold sweats are also the symptoms for tuberculosis and should be tested immediately. TB bacteria spreading via droplets, either through sneezing or coughing, and the other person inhaled the bacteria in. If the immune system failed to detect the tuberculosis, it will reside inside of the lungs and later becomes either latent or active tuberculosis. TB diseases in lungs or throats can be very infectious, but TB in other parts of the body, such as the kidney, the spine, it's usually not infectious because it does not come in touch with the air or droplets. There are two types of tests for TB disease. One is TB skin test and the other is TB blood test. For TB skin test, by injecting a small amount of fluid called tuberculin, such as this picture, to the patients, and the patients must wait between 48 to 72 hours to see the results. For positive results or positive TB skin test, there's going to be an increase in size at the injection sites. This picture is shown over here. For negative, there's no reactions to tuberculin injections, and there's no changes in the size at the injection sites. For TB blood tests, and the FDA have approved two types of tests. One is the quantiferon TB Gold in-tube test, and the other is T-spot TB test. They both detect if there is a TB agents, mycobacteria agents inside of our body, but they cannot detect if it's actually latent or active tuberculosis. Regardless of latent or active TB infections, they usually have the same treatments is by taking several antibacterial and drugs from 6 to 9 months depending on the patients, and also to prevent the mycobacterium to develop into a more resistant strains. There are 4 distinctive drugs, the INH, RIF, EMB, and PZA. In terms of preventions, first and foremost is that, and most important, is that preventing exposure to people with TB disease or area facility that has high risk of TB disease. Those who are especially high risk of disease, such as immune suppressed, HIV, or people with underlying issues, should be avoiding those areas as well. BCG vaccine can also be used, but the CDC has claimed that BCG vaccine is not as potent and does not protect you 100% from tuberculosis. The CDC is an incredible source that is very reliable and credible. They also provide a lot of details and information about not just the disease, but how to prevent it and how to protect yourself from it. The Orange County Healthcare Agency Public Health also provides a lot of information about tuberculosis. They also provide TB screening and treatment services for eligible Orange County residents. I have included their phone number as well as their offices and address for those who seek for help. This is my reference for the presentations and also the end of my presentations. Thank you so much for listening, and I hope that you stay safe and stay strong.